Hi, my name is Dr. Eva Feldman. I'm a professor of neurology at Michigan Medicine. In January of 2020, my 32 scientists and I launched a new program, the NeuroNetwork for Emerging Therapies, so that we could collaborate with our international colleagues on the three areas that we're most passionate about: the complications of diabetes, Alzheimer's disease and dementias, and amyotrophic lateral sclerosis, also known as ALS. What occurred then in March was COVID. That clearly affected us medically, scientifically, and of course, personally. Medically, we began to see that our patients with diabetes had a poorer outcome if they developed COVID than someone who did not have diabetes. This has led to two things. One is we are now doing new research in our laboratory that's been funded by the National Institutes of Health to understand why the immune system of someone with diabetes is more at risk when they develop COVID. Secondly, we've now established a new chronic COVID complications clinic where we are emphasizing a new understanding of why patients who have developed COVID can develop brain fog after the disease, along with a disease known as neuropathy, which is injury to the nerves. Now, our research on diabetes has, of course, not been limited to COVID, but we continued our work, not only here, but with our international collaborators. And we discovered in 2020 two pivotal things. One is this: if you can have an even modest weight loss, you are able to stop the progression of nerve injury with diabetes. So you can stop the progression of neuropathy. Secondly, we discovered that how well you think your brain health really is very pivotal and intersects with how well your diabetes is controlled and also what your diabetes diet consists of. Particularly, good fats are good for the brain, bad fats or saturated fats are not. Now, our work in Alzheimer's disease and dementias took a new level this year when we developed a way to label stem cells in the brain so that we can follow them, to allow stem cells in the brain to be not only a new therapy, but also potentially a new way for us to understand the biology of how good diet and exercise improves brain health. And finally, concerning ALS. We were very fortunate to receive a $2 million donation this year from Mr. Scott Pranger to assist us in our research in ALS. And for that, we have now named the ALS clinic after Mr. Pranger, the Pranger ALS Clinic. In this clinic, we discovered two things. One is that there's a clear, strong link between the environment and the likelihood of developing ALS, something that we continue to pursue, particularly now we know new data on air pollution. And secondly, that the immune system is important in ALS and is a therapeutic target. We're doing 4 new clinical trials in ALS targeting the immune system. Thank you very much for your attention. I hope if you want more scientific statistics, you can go to my website, mneuronet.org. And 2020 is going to end for me with a vaccine against COVID. I hope it does for you also, either this year or next year. Please join me in getting vaccinated and also join me in having a happy, safe, healthy, and productive 2021.